Doctor, I'm fine at present. I'm young. I haven't got any of these problems. But given what's happened to my father, I wanted to know whether there are any drugs I can take early to prevent the disease so I won't get it.
No. Unfortunately, at present, we haven't got any drugs that stop the disease from developing in healthy people. We don't have drugs for what's known as primary prevention. However, research is being carried out in Italy and Europe and the United States to develop drugs for use in these situations. We're using the hereditary forms as a study model at the moment, and what we're doing is taking photographs from the point of view of the health of their brains, of course, of healthy people who, however, carry a mutation which we know does cause Alzheimer's disease. So these people are healthy, but they are certain to develop Alzheimer's disease during the next, say, 10, 20 or 30 years. Now, we're studying them with MRI and PET scans and spinal taps every year, and we'll be treating them with amyloid blockers, which are drugs that act directly on the molecular cause of Alzheimer's disease, to see whether the progression of the damage, which can be seen from the MRI and PET scans and spinal taps, even before the onset of symptoms, are reduced. Either reduced, attenuated, or slowed down.
Earlier, you told me that hereditary forms are a bit different from the other forms. So what's the point in studying all this in people who have the mutation? What use is it to people who haven't got it?
Well, that's a very good question, and the idea is that the hereditary forms of Alzheimer's disease are very similar from the molecular point of view to the sporadic forms, meaning those which occur without any change in DNA. It's true that the group of hereditary forms is very small. In fact, they account for little more than 5% of all patients, but they are very similar to the sporadic forms. So if these measures that we are trialling currently on the genetic forms work, then we can reasonably think that it's worth testing them in the sporadic forms too.
nelle forme sporadiche.